Panic attacks and autistic meltdowns are two distinct experiences that affect individuals differently, often triggered by anxiety or sensory overload, respectively. A panic attack is characterized by an intense surge of fear and physical symptoms such as a racing heart, shortness of breath, and dizziness, which can come on suddenly and peak within minutes. In contrast, an autistic meltdown is a response to overwhelming stimuli and can involve a loss of behavioral control, with signs like intense crying, shouting, or aggressive behavior, and may take longer to subside. Treatment for either condition varies, with panic attacks often managed through therapy and medication, while autistic meltdowns may be mitigated with sensory accommodations, structured environments, and individualized coping strategies. Risk factors for panic attacks include genetics, stress, and certain changes in brain functioning, whereas autistic meltdowns are associated with the neurological differences inherent in autism spectrum disorder, ASD. Here are detailed aspects of panic attacks and autistic meltdowns, exploring their nuances and complexities. Trigger mechanisms: psychological stress versus sensory overload. Panic attacks and autistic meltdowns can sometimes be confused due to their outwardly similar manifestations, such as intense emotional responses and physical outbursts. However, their triggers are fundamentally different. Panic attacks are typically precipitated by psychological stress and are rooted in the body's acute response to perceived threats, which activates the fight or flight response. This might include situations causing worry, fear, or anxiety. On the other hand, autistic meltdowns are often the result of sensory overload or an overwhelming environment. For individuals on the autism spectrum, too much sensory input, like loud noises, bright lights, or crowded spaces, can lead to a meltdown as a response to the overload, and this is not directly related to the fight or flight reaction associated with panic attacks. Understanding these triggers is vital for appropriate response and support for each condition. Behavioral manifestation: intense fear versus overwhelm response. Panic attacks and autistic meltdowns may appear similar as intense, sudden bouts of distress, but they differ significantly at their cores. Panic attacks stem from an acute surge of intense fear or discomfort peaking within minutes, often accompanied by physical symptoms like heart palpitations, chest pain, and shortness of breath, creating a fear of impending doom or loss of control. Autistic meltdowns, on the other hand, are responses to sensory overload, emotional overwhelm, or an accumulation of stress, manifesting not from fear, but from the need to escape an overstimulating situation. During a meltdown, an individual with autism may exhibit behaviors such as shouting, crying, or physical aggression, which are coping mechanisms to manage the sensory assault or to communicate an inability to process the environment. Recognizing the underlying causes, fear versus sensory overwhelm, is crucial for accurate diagnosis and effective intervention for each condition. Duration and onset: sudden and acute versus gradual or sudden. When distinguishing between a panic attack and an autistic meltdown, the dimensions of duration and onset are crucial. Panic attacks often manifest suddenly and without warning, enveloping the individual in extreme anxiety and physical symptoms such as palpitations, sweating, and trembling, typically peaking within minutes. In contrast, autistic meltdowns may have a more gradual buildup as a response to sensory overload or overwhelming emotions, although they can also strike abruptly. Meltdowns are not confined to a short time frame and can vary in length, potentially extending to a much longer duration if the triggering stressor persists or isn't managed effectively. Understanding these nuances is vital in providing the appropriate support and interventions for individuals experiencing these distressing episodes. Communication ability: verbal difficulty versus variably impaired. Understanding the nuanced differences between a panic attack and an autistic meltdown is crucial in providing appropriate support and intervention. During a panic attack, an individual might experience verbal difficulty due to overwhelming anxiety and physiological responses such as hyperventilation or intense fear, potentially rendering them temporarily unable to communicate effectively. In contrast, an autistic meltdown, often triggered by sensory overload or an inability to process complex social cues, can lead to variably impaired communication. Those experiencing a meltdown may completely lose the ability to speak or might communicate in an atypical manner, reflecting the sensory and processing challenges they face. Recognizing these distinctions helps tailor responses that respect the individual's needs while ensuring their safety and comfort. Coping strategies, reassurance and breathing exercises versus routine and predictability. Differentiating between a panic attack and an autistic meltdown is crucial as both conditions demand distinct coping strategies to provide effective relief. During a panic attack, the individuals often benefit from reassurance and breathing exercises, which aim to calm the sympathetic nervous system's acute stress response. Techniques like deep diaphragmatic breathing can help reduce the intense anxiety by inducing a relaxation response. In contrast, for someone experiencing an autistic meltdown, implementing routine and predictability is paramount. Consistency in the environment and clear expectations help mitigate sensory overstimulation and reduce the likelihood of meltdowns. In moments of distress, guiding them back to familiar, structured activities can serve as a calming influence, as unpredictability often exacerbates their stress. Understanding the nuances of these conditions and their management can dramatically improve the quality of assistance provided.